So if you haven't figured it out by now, NCLEX style questions are a little bit different than the questions that you get asked in your core classes. NCLEX questions are going to give you a whole ton of data about your patient, and you're going to be asked to make a decision about your patient's care based off all that data. Sometimes you're going to know what's going on with the patient. More often than not, you're not going to be told your patient has CHF, your patient has a hip fracture. You're going to be given a lot of information about your patient, and then you're going to have to decide what the next best thing to do, the first thing to do, the many things you would do to create a plan of care for your patient might be. That's the tricky thing, right? You look at those questions and you get a little bit overwhelmed, and you go and you try to get some help, and all you hear are these two little words. You need to learn how to critically think, critically think, critically think, right? Oh, I get so tired of hearing those words. Could somebody tell me how to critically think? Please. Here's the thing. You critically think every single day, every day. When you decide to take a different route to work because the traffic person says there's a big wreck on the highway, when you decide to wear a coat because it's going to be 30 degrees according to the weatherman, when you decide not to go take your picnic outside in the pouring rain, you have used critically thinking skills. You have. Here's the difference. Nursing / medicine, that's a whole different language, right? It's not something that you're comfortable with. You don't do it all the time, so you have this little hiccup in your step. You think there's some magic thing that is out there that you gotta go get before you can figure out the answer to the question. So you're grabbing tons of books. You think, you can go to the internet, you can ask your friends, somebody please tell me how to critically think. All right, so take a breath. You do it every day. I promise you do. You just have to learn to apply it to a question. So critical thinking is about gathering data, making a decision based on that data. Let's look at a couple of examples, okay? And this is just a really simple question that I made up. Doesn't exist anywhere, so don't go trying to look for it in some book, okay? You have a patient that is 1 day post-op from having a radial ulnar repair. He had surgery on his arm. He's 15 years old. You go into his room, and the first thing he says to you is that his arm is really hurting. You ask him, how's it hurting? He says, oh, it's just throbbing. You ask him to rate his pain, and he says, oh, that's about a 2 out of 10, I guess. What's the first thing that you should do? Notice that word, first. That's a piece of critical thinking information. So let's look at the data. He's a kid. He's had surgery. His pain is really not that bad. It's 2 out of 10. Okay, easy enough. So my question answer choices are: give the patient Norco for pain. Give the patient morphine IM for pain. Call the doctor. Reposition the client for comfort, right? That's the one you're going to pick first. You're first going to reposition your little guy and hope that he gets more comfortable. Hope that his pain is tolerable. So let's just say you go back in 30 minutes later. Exact same situation, exact same patient. His pain is now a 3 out of 10. You've already repositioned him. What's the next thing that you should do given those answers? Give the patient Norco for pain, give the patient IM morphine, call the doctor, or reposition the patient for comfort. Well, let's critically think. You've already repositioned him, right? Morphine is not something that you give to someone that has a little bit of pain. Calling the doctor is just probably not a good idea in this situation because the doctor already expected him to have some pain. That's why I wrote an order for Norco or morphine, right? Okay, so you're going to give him a pain medication. Which one of those two pain medications is best? Well, for just a little bit of pain, that will be Norco, right? So you're going to give your patient Norco for pain. You go back in a little bit later and you're going to assess him again, and this time he tells you that he's having this really sharp pain in his arm up here and that he really is having a hard time feeling his fingers. Well, okay, so this is a different situation that's going to cause you to critically think in a different way, right? First thing you need to do is check your client's pulse. Do you feel one? If you don't, the first thing that you should do is not medicate his pain. The first thing you should do as a nurse that wants to keep their patient safe is to call the doctor, okay? So you see, it's the same situation. It's the same patient. We just had different data, which allowed us to critically think and make a different decision. It wasn't that hard, was it? Okay, so if you guys want some more examples, you can email me and we can kind of chat it out a little bit and see how we can get you in a better groove with critical thinking skills. I'm really sorry if you've been made to feel like you don't know how to do this, because I promise you do. I am so bummed to think that anyone would just tell you to critically think and then not tell you how to do it or help you out with it. So I'm going to promise you that it gets better. By the time you get to third semester, fourth semester, you are going to be rocking out those NCLEX questions. You're going to know how to critically think because your language is now adapted. You know the world of nursing and medicine, right? And you figured out that critical thinking is the same thing you do every single day. So I want to leave you guys with that. Just email me down here if you need some help. Otherwise, peace out.